diseases of the liver. Before we start diseases of the liver, we have to know what is jaundice. It's a sign for abnormal or pathology in the liver. It means yellow coloration of the skin, sclera, and the mucous membrane due to increase in the level of bilirubin. Normal level of bilirubin shouldn't exceed 1.2 milligram per dl, but when it is exceed 2 or 2.5, so it will be presented as a yellow coloration in the skin, sclera, and the mucous membrane, and this is jaundice. Jaundice have many types according to the cause of the increase in this bilirubin. It's either in the liver, the cause in the liver, and we call this hepatocytic causes or hepatocellular causes, or before the liver, and we call this hemolytic causes, and sometimes outside the liver or in the biliary system, biliary tree, and this is obstructive causes. So jaundice are three types, either problems before the liver, and we call this hemolytic jaundice. This is pre-hepatic, increase in the destruction of red blood cells due to either hemolytic anemia, incompatible blood transfusion, destruction of RBCs due to malaria, and so on. Sometimes the causes is after the liver or post-hepatic due to obstruction in the biliary tract or biliary tree due to either gallstones, stricture, stenosis, cancer, head of pancreas. All of these causes obstruction in the biliary tree, so bilirubin is not passed through its normal pathway, and the cause here is obstruction. The third cause is something disease or pathology in the liver itself or in the hepatocytes itself that can't metabolize the bilirubin. Hepatitis, whatever the cause, viral, toxic, tumors in the liver, cirrhosis, and we will know what is the meaning of cirrhosis a few minutes later. Now let's start with inflammation of the liver. Inflammation of the liver called hepatitis. The most common cause of hepatitis is viral hepatitis. Viral hepatitis either acute or chronic. Let's start with acute viral hepatitis. It's acute inflammation with liver necrosis due to viruses. We have many types of viruses. We'll start with hepatitis A, and we have to know, is it DNA or RNA virus? Hepatitis A is RNA virus. We want to know incubation period is up to 6 weeks. No carrier state, not progressed to chronic state. I think many of us may experience hepatitis A due to fecal oral transmission, eating dirty food, for example, and the manifestation of hepatitis that we will discuss appear after about 6 weeks. It resolves spontaneously as any viral infection and not progress to chronic state. It is RNA virus. This is hepatitis A. No problem from hepatitis A. Let's move to hepatitis B. It is DNA virus. The infection here is parenteral. I mean blood transfusion, blood contamination, or sexual, or from mother to her baby, transplacental baby fetus during pregnancy. Incubation period here is very long, up to 6 months. This is a progress to carrier state and chronic hepatitis, which we will discuss later. So it's a serious type of viruses. Hepatitis C, it's again RNA virus. Again, it's parenteral, RNA like A, parenteral like B, long incubation period like B. It's endemic here in Egypt. It is usually progress to chronic state, and there is carrier state. Many other viruses are present, but these are the most important ones. Now, acute viral hepatitis. What is the clinical picture of this patient? First of all, pre-icteric phase. I mean, icteric means jaundice. This is the phase before jaundice appears. Just mild fever, maybe nausea, vomiting, anorexia, gastric pain, no tolerance to fat, especially because fat is metabolized in the liver. This is before jaundice appears. Then, after about 2 weeks, jaundice starts to appear. This is icteric stage or icteric phase. Here, once jaundice appear, the diagnosis is very easy, and there is a yellow coloration, as we said, it's clear on the mucous membrane, and the stool becomes pale and clay because it is a type of hepatocellular jaundice. After that, there is recovery stage. Recovery stage in hepatitis A. No recovery stage in hepatitis B or C, or it's not recovery, will proceed to chronic hepatitis. Now, acute viral hepatitis. Are there any complications? Sure. According to the immunity of the patient, maybe complete recovery like hepatitis A, maybe failure of recovery in any type of hepatitis according to the immunity of the patient, may progress to fulminating viral hepatitis, that this is fatal, may progress to chronic hepatitis, and this is seen only in B and C, carrier states in B and C, cirrhosis, we will discuss what the meaning of cirrhosis, and maybe hepatocellular carcinoma or hepatocellular failure. It's associated with carcinoma, and maybe patient progress to liver cell failure and die from liver cell failure. Now, we finished acute hepatitis. Chronic hepatitis, we have to define a chronic hepatitis. Chronic hepatitis, it means there is symptoms and increase in the enzymes of the liver for more than 6 months. This is seen mainly due to viral hepatitis, but there are many other causes like metabolic diseases. For example, Wilson disease, there is abnormal metabolism of copper. Alpha-1 antitrypsin deficiency, it's a very important enzyme, sometimes deficient genetically and presented with problems in the liver. So maybe due to metabolic disease, autoimmune disease, and alcoholism, sometimes drugs. But most common cause here in Egypt is due to viral hepatitis. So chronic hepatitis is not only viral, there are many causes of chronic hepatitis. You should know this. Okay, what we will see in chronic hepatitis are very important manifestation. We will see inflammation, we will see necrosis of the liver cells, we will see fibrosis, and the problem here is due to this fibrosis, and other hepatocytic feature is not of your if you're concerned, it's not important for you, but you have to know that there is inflammation, necrosis, and fibrosis, and we have to grade these necrosis, inflammation, and fibrosis, give the patient points or grading and staging. So what's meaning of grading and staging of chronic hepatitis? This helps us to know the etiology, the degree of activity, the degree of fibrosis, and at what stage this patient is present now, and how will he progress. So grading of hepatitis is measuring of this inflammation and inflammatory infiltrate, while staging of hepatitis is giving scores for this fibrosis. So inflammation, necrosis are estimated by grading, give this grade 1, 2, 3, and so, and inflammation and the degree of fibrosis is estimated by staging, stage 1, 2, 3, and so. So in liver biopsy, we have to comment on grading and staging to know the activity and the fibrosis in these chronic hepatitis. Now, what are the complications of chronic hepatitis? Maybe proceed to cirrhosis and portal hypertension, and we'll discuss this, liver cell failure, and carcinoma. So cirrhosis, what's the meaning of cirrhosis? Cirrhosis, you know that the liver has a special architecture, which is hexagonal central vein, and hepatocytes arranged in trabeculae, plates, between them there is canaliculi and sinusoids. This architecture should be preserved, should be respected. When this architecture is distorted, it is liver cirrhosis. So we have to define cirrhosis. First of all, you have to know that cirrhosis is irreversible disease. No drug can return the liver back from cirrhosis to normal liver. It's progressive disease. What we have to do is just delaying this progressive course. So cirrhosis means that there is necrosis in the liver cell, and then this necrotic cell will regenerate. You know that liver cell is a stable cell and it can regenerate. But this regeneration is not respecting the liver architecture. So it will be surrounded by fibrosis, causing nodule formation. So what about the architecture? It will be lost. What the meaning of architecture again? It's hexagonal, central vein in the center, hepatocytes arranged in the trabeculae. This will be lost. And there will be fibrosis or fibrotic nodules. So the circulation, unique circulation of the liver, passage of, you know that liver has a double blood supply, portal vein and a hepatic artery. Something go in and something go out. So this unique microcirculation is interrupted. This is the meaning of cirrhosis. Now, classification of cirrhosis means causes of cirrhosis. It is causes of cirrhosis. What causes cirrhosis? Why this cirrhosis happen? It's either due to hepatitis. Chronic hepatitis may precede to cirrhosis. Necrosis in the liver, whatever the cause, sometimes drugs, chemicals, toxins. Alcoholic cirrhosis, this is usually seen in Western countries. Biliary cirrhosis, there is biliary obstruction. Cardiac cirrhosis, this is due to a chronic venous congestion of the heart, which affects many organs. One of them is the liver. Immunological cirrhosis, there may be autoimmune disease. Metabolic cirrhosis, we just said about, talk about Wilson disease and alpha-1 antitrypsin deficiency. This cause chronic hepatitis and precedes to cirrhosis very early in teenagers patients. Malnutrition, syphilis, and sometimes cryptogenic, unknown cause, usually due to drugs or so. So the most common cause of cirrhosis here in Egypt is post-hepatic cirrhosis, for sure. This is the liver showing cirrhosis. You know, this liver, this surface should be smooth. You know, you see these small nodules. The nodules here very small, less than a pinhead, less than 3 millimeters diameter. This is called micronodular cirrhosis. And this is cut section in the liver, and you see these nodules surrounded by fibrosis nodules. This is not normal liver. This is cirrhotic nodules. Okay, what are the complications of liver cirrhosis? What will happen to the patient who have cirrhosis? First of all, portal hypertension. This fibrous tissue will entrap the blood vessels, especially the portal vein and portal circulation. The patient will be manifested by very important complications. Like dilatation of the portosystemic anastomosis, and this may lead to varices. We discuss varices in the general pathology. This is due to dilatation and tortuosity of the veins. Due to portal hypertension, the blood pressure inside the portal circulation will be very high, so blood try to escape from this tension. It will go to systemic circulation through a few anastomotic veins or anastomotic sinusoids between them. These sinusoids are present in the lower part of the esophagus, around the umbilicus, and the lower part of the anus. This patient will have, this is the esophagus from outside, and this is the stomach. You see these veins, corrugated veins. From inside, it has a tortuous, dilated, and may cause hematemesis, and sometimes it's fatal. So this causes varices. Esophageal varices may be fatal. Caput medosa, it means dilatation and tortuosity of the veins around the umbilicus. And biles, this is due to varices in the anal, lower part of the anus. Portal hypertension also causes chronic venous congestion in the GIT and the spleen, causing splenomegaly. Egyptian spleen is very known, it's very huge spleen. It may cause ascites. You don't have to know the pathogenesis. You just know that this is ascites. Ascites means accumulation of fluid inside peritoneal cavity. Okay, all of these are manifestation of portal hypertension. Also, liver cirrhosis may cause or may end in hepatocellular failure. Let's go to liver abscess. Liver abscess, it's an abscess like any abscess. It's a separation in the liver, maybe due to what will cause abscess, what will introduce a pathogen into the liver, maybe through systemic circulation like puerperal sepsis. This is sepsis after birth or related to birth to labor in females. Maybe bacteria comes from osteomyelitis. This pathogen may go to the liver through portal vein. Maybe it is portal bulimia. Any infectious diseases like actinomycosis, amoeba, or penetrating injury from outside. So the abscess may be single or multiple. It will be multiple if it comes through a systemic or portal circulation, and single like in amoeba and hydatid cyst. This is liver abscess. This is amoebic liver abscess, characteristic by dark blackish or brownish coloration. We call it chocolate abscess, chocolate. And this is liver abscess pyogenic, and this is pus inside the liver. Treatment here is surgical. Now let's go to tumors of the liver. Liver may have benign tumors, and the most common benign tumor ever is cavernous hemangioma. It is the most common benign tumor in the liver. But sometimes we see epithelial tumor, which is liver cell adenoma, and we have to know this because it's associated with patients who receive contraceptive pills. So female patients who take contraceptive pills may be presented with liver cell adenoma. Now, what are the malignant tumors of the liver? Before we start with the malignant tumor of the liver, you have to remember that the liver is very common site for metastasis. Do you remember in general pathology? LLBB, liver, lung, bone, brain. Liver, so the most common malignant tumor in the liver is metastatic. Then we go to primary carcinoma of the liver. The most common one, and we have to study, is hepatocellular carcinoma. Let's go to hepatocellular carcinoma. It's epithelial tumor. Okay, this is the most common primary carcinoma of the liver. When the MCQ is saying what is the most common malignant, you have to choose from all of these. You have to choose metastatic. What is the most common benign? You have to choose hemangioma. Okay, so let's go to a very important question. What causes enlargement of the liver? Hepatomegaly. What causes hepatomegaly? Either inflammatory lesions like viral hepatitis, as we said, pyogenic abscess, suppurative, granuloma like syphilis, tuberculosis, parasitic, sure, bilharziasis. Don't forget bilharziasis. We are endemic for bilharziasis. This is inflammatory lesions. Circulatory, maybe chronic venous congestion, which cause enlargement of the internal organs. Degenerative, like amyloid. Do you remember amyloidosis and fatty change of the liver? This causes hepatomegaly. Metabolic disease like diabetes and many storage diseases. Blood diseases like leukemia and polycythemia, and of course tumors. So it's very important question to know what causes hepatomegaly. Now we finished liver, we will go to the gallbladder. Inflammation of gallbladder is called cholecystitis. Cholecystitis, either acute or chronic. Acute cholecystitis, like any hollow organ due to obstruction usually, then superadded infection. Obstruction in cystic duct or in the neck of the gallbladder, then superadded by bacterial infection. Grossly, the gallbladder is enlarged. Microscopically, it starts with catarrhal inflammation, and then it may proceed to suppurative inflammation. Acute cholecystitis is common, so we have to know what are the complications. Resolution may go with treatment or without, may proceed to empyema. Empyema of the gallbladder means that gallbladder turns to a bag full of pus. bag full of pus. This is suppurative inflammation, and the gallbladder become very large and it's full of pus. This is empyema of gallbladder. It may precede to gangrenous inflammation. It may cause stone formation. We will discuss stone in the gallbladder a few seconds later. It may cause perforation. It may cause chronic. It was acute, then it become chronic. After each 2 or 3 weeks, the patient complains. Okay. Now, what is chronic cholecystitis? It is more common than acute cholecystitis. It is a disease of F. What's the meaning of disease of F? It is common in female, 40 years, fat, fertile, have many babies, usually fatty. Okay. Chronic cholecystitis, it may be acute and complicated by chronic or maybe stones. Here the wall is thick and the gallbladder is small, usually fibrotic, unlike acute cholecystitis where the gallbladder is enlarged. Microscopically, it's chronic inflammation. Okay, complications here: adhesions, fibrosis, complications of the stone, and the most important one, that chronic irritation may proceed to malignant transformation, may proceed to carcinoma. This is acute cholecystitis. This is not normal cholecystitis. A gallbladder normally about 3 or 4 centimeters by 2, for example, or 3 by 2. This is about this is a ruler here. I think this is about 10 or more length in 4 or 5 centimeter width. This is very huge acute cholecystitis. Now, what are the gallstones? Gallstones usually seen in adults, female, fertile, 40, each many fat, each eat large amount of cholesterol, may have cholecystitis or diabetic patients. All of these are predisposing factors for gallstones. Gallstones occurs due to infection and superadded by inflammation and stasis of the bile inside the gallbladder. Now, we have to know what are the types of the stone. The commonest type, and this is a question for MCQ, the commonest type is mixed stone. This is the commonest type, but sometimes it's not mixed, it's pure. It's formed only of cholesterol, and this is the commonest pure stone. Be careful here for the question. If the question was what are the commonest type, it will be mixed. What are the commonest pure type? It will be cholesterol stone. Sometimes it's formed only of pigment, bilirubin in hemolytic anemia. Sometimes it's formed only of carbonate, and this is rare. And the most common type is mixture of all of these. So, complication of gallstones, either complication in the gallbladder itself or complication due to its stone which is impacted in the biliary tract. Gallbladder itself, of course, the patient will be complaints of acute and chronic cholecystitis, acute and chronic, and irritation may cause perforation and may proceed to carcinoma. Impaction of the stone in the biliary tract may cause obstruction of the neck of the gallbladder, and the gallbladder proceed into mucocele. Mucocele means that the gallbladder it changed here into a sac full of mucus. Okay, it may lead to obstructive jaundice, and if the stone go to the ampulla of Vater, which is at the end of the biliary tree, this will cause pancreatitis, and very serious, very serious complication, pancreatitis. Gallbladder may show tumors. Benign are very rare, but malignant tumors here is adenocarcinoma. The most common malignant tumor here is adenocarcinoma. Thank you.